عزيزة الزرقاء البارحة هصورك هسه هصورك شو تصورك؟ هسه بتزعل أنا ما بعرف جاي تكتب جاي تكتب بيقول لك عزاز مني شو الأسئلة طنياها موبايلك زين عزاز مني شو الأسئلة طنياها خوش ياسر هسه عزيزك ياسر Good afternoon, everyone. You are ready to start the class? Yes, we are ready. I'm Dr. Akhlabi. Today I'm going to talk about recitals, including foreign body cell reaction, tuberculosis, and Wilms tumor. The first one is foreign body cell reaction. At first, I said that we have our theory session tomorrow for about psychiatric disease from 8 o'clock to 12 o'clock tomorrow. But today I want to talk about practical slides that you should see about foreign body cell reaction and tuberculosis and Wilms tumor.
Do we have practical tomorrow?
Yeah.
Do we have practical tomorrow?
Yeah. No. Today, all of the practical session, I said today foreign body cell reactions. If any foreign body includes endogenous or exogenous. Endogenous such as HF, keratin, cholesterol, or gods or copy of the gods. All of these foreign bodies, including endogenous and exogenous agents, can cause a kind of reaction in the body. At the pathology features, you see some clues that I said for you. Foreign bodies, including endogenous, such as keratin material or cholesterol or urat or talking of gods, or exogenous, such as suture material. If you had a cut in your skin and you may suture that. The suture string that's linked to a foreign body type cell reaction, or any piece of wood, a tiny piece of wood that would inject into your skin, or soft tissue that can cause a chronic inflammation and make a foreign body type cell reaction. The reaction provides a mechanism for elimination of the foreign body. For elimination of the foreign body, and reaction is initially active and gradually can cause foreign body type granuloma. Foreign body granuloma, including some parts. For you, including a multinucleated giant cell with haphazardly arranged nuclei. These giant cells are fused macrophages, and foreign body material can usually be seen in their cytoplasm. You've seen this slide. Giant cells are formed, giant cells are formed from a fusion of multiple macrophages. Multiple macrophages that are present in the inflammation site. Each one have one nucleus. They try to share their cytoplasm and form a giant cell with a shared eosinophilic cytoplasm and have multiple okay. Their nuclei are rooted in a shared cytoplasm. That means so-called giant cell. This giant cell has a special feature. Their nuclei are arranged haphazardly. Versus tuberculosis, as I explained that the next slide, you see a giant cell with a different feature. In the reaction, in the primary type giant cell reaction, you see this kind of giant cell. Giant cell with haphazardly arranged nuclei. And you see these giant cells around a foreign body that may be a suture string or protein material or other foreign bodies. In our slides, there is a skin tissue with foreign body reactions and degenerated hair. The foreign body in your slides is hair. Inflammatory reactions is evident surrounding this area, along with giant cells, with this feature that I explained. The inflammatory cells are mainly lymphocytes and macrophages. These giant cells also known as epithelioidiocytes. Does anyone know why they say this epithelioidiocyte? Epithelioid, oid and suffix means resemble or means similar to. Epithelioid histiocytes are activated macrophages resembling epithelial cells, elongated with finely granular, pale eosinophilic cytoplasm and central ovoid nucleus. In prolonged situation, fibroblasts can be present and are visible around the inflammatory cells. You see in your slides the hair shaft. These are hair shafts. Light brown sections of the hair, and around them you see inflammatory cells including lymphocytes and macrophages, and some areas you see giant cells with haphazardly arranged nuclei. These are hair shafts, and these are macrophages and lymphocytes, and this one is giant foreign body type giant cell. These are another slides. Pay attention to the haphazardly arrangement of the nuclei. Okay, these are another photos. You see exactly around the hair shaft, one giant cell, haphazard nuclei. Okay, here, this is one of your slides. Is there any question?
No.
Okay. Another one tuberculosis or granulomatous tuberculosis. Granulomatous tuberculosis, you know mycobacterium is one weekly gram-positive bacteria that may involve many organs. For example, lung or lymph nodes or all of organs of the body may be involved by mycobacterium. Mycobacterium is a bacteria that can enter to macrophage and replicate within the phagosome by blocking fusion of the phagosome and lysosome. You know, if a mycobacterium enter to a macrophage with a phagosome, what is phagosome? You know?
It's the fusion of the ingested phagocytosis material with the lysosome. And this will form a complex, and the ingested material is degraded. And
you know, phagosome is the portion of cytoplasm that intrude to the cytoplasm, and mycobacterium enter it. So a lysosome, that is one of the cellular organelle and include many enzymes to digest mycobacterium or another bacteria, fuse with it. This fusion lead to formation of phagolysosome. It means phagosome, lysosome. Fusion of them form phagolysosome. Okay? In phagolysosome, mycobacterium is married with enzymes in lysosome and degrades, and it can be controlled. What about 3 weeks after infection? T helper bond response is mounted and activated macrophages to control the infection. For control such infections, some bacteria can remove with this process, but some of them, such as mycobacterium, only that we control, but not cannot completely remove. So the body tries to control such infections such as tuberculosis. In our slides, lung and lymph node tissue can be seen. I think your slide is lymph node. There are tubercles consisting of epithelial cells, lymphocytes, and giant cells, and central area of caseating necrosis. Caseating necrosis, what does mean caseating necrosis, you know?
Necrosis with cheesy appearance and inflammation cells in these cells.
Yeah, exactly. In a tuberculosis granuloma, consisting of epithelioid cells, lymphocytes, and giant cells. Epithelioid cells are around the center of the infection. Giant cells are formed from fusion of the epithelioid histiocytes and is formed from sharing their cytoplasm and shape, the horseshoe-like giant cell. Difference between giant cell in tuberculosis and giant cell in foreign body reaction. You know, in a giant cell, tuberculosis giant cell, there are an arrangement between nuclei and horseshoe-like, but in foreign body type giant cell reaction, nuclei are haphazardly arranged. Okay, there's difference between them. Differences between giant cell and TB granuloma with giant cell reaction and foreign body giant cell reaction is the giant cell in foreign body, the nuclei arranged haphazardly, but in this one, arrangement are horseshoe-like. Okay, in the TB granuloma, you'll see epithelial histiocytes, giant cells, lymphocytes around a necrotic area or caseating necrotic area. Caseating means cheese-like. In gross examination, you see cheese-like materials. These giant cells, so-called Langhans giant cells. Langhans giant cells. Langhans giant cells. No Langerhans. Langhans. Langerhans is in
Different.
the skin. In the skin, and many students they make a mistake about it. Langhans giant cells. There are Langhans giant cells which are formed by fusion of epithelial cells and contain nuclei arranged in horseshoe-like pattern at the periphery. Okay, you see a TB granuloma. This photo shows pulmonary tissue or lung tissue. You see alveolar valves, alveolar space, that's involved by a TB granuloma. Color of lymphocytes are seen surrounding the necrotic area, aggregation of epithelial cells, and giant multinucleated cell in Langhans type, a horseshoe-like pattern you see, and the beginning of central caseous necrosis is seen in this area.
What's color of, could you go back? Color of lymphocytes?
Lymphocytes is
Color.
not really visible in this slide.
No, there's a written color.
Color means aggregation. Color means surrounding the necrotic area. Lymphocytes are present here in all the background of the granuloma. TB granuloma, these are multinucleated giant cells, and in horseshoe-like pattern nuclei. Confluent granuloma means this term is used when all of the TB granuloma are fused with them. It means confluent granuloma. When all of these granuloma fused with each other, they use the term confluent granuloma. You see this slide, the section of the lymph node that's involved by some TB granulomas with central necrosis. All of them are multiple TB granuloma that involve lung tissue. You see in this part of the picture, lung tissue is alveoli and multiple TB granuloma. What are these black pigments? You know?
Artifacts?
No. This one.
Something to do with blood?
Blood cells. Blood cells.
No. These are macrophages that
Hemosiderin, macrophages which
Carbon.
ingested blood cells.
these are really some macrophages that ingest some carbons that are in the air that are inhaled with our respiration.
Anthracosis.
Yeah, exactly. Anthroposis. Is anthroposis. These are macrophages that contain some carbon particles that are inhaled, then they are inhalation and enter in macrophages on that are present in our lymph nodes in mediastin. All of us that live in Tehran, for example, with air pollution, if our lymph nodes dissect and evaluate of them, we see anthroposis. Even if we have no smoking or in air pollution, this events may happen. Anthroposis in our lymph nodes. Okay. Now comes Joel, so a perfect photo. You see horseshoe-like pattern. Okay. And about the third one slide, I want to talk about Wilms tumor. Any question? Okay. Wilms tumor is the most common primary renal tumor of childhood and occur between 2 and 5 years of age. In gross examination, you see in the kidney these tumors may present as a large, solitary, well-circumscribed mass, soft inconsistency, and tan to gray cut surface. Occasional foci of hemorrhage and cyst formation may be present or necrotic area. Okay. I would explain all of the tumoral and non-tumoral disease of the childhood tomorrow in the session. You see this slide, Wilms tumor and lower pool of the kidney. I said in the previous slide, there is a solitary, well-circumscribed or well-defined tumor or lesion with a firm consistency or soft consistency with foci of cystic degeneration and areas of necrosis and hemorrhage. In the microscopic examination in your slides, you see some clues. Wilms tumors are characterized by different stages of nephrogenesis. In the pathology sections, you see three-phasic combination of blastomal, stromal, and epithelial cell type. Okay, this tumor have three components. Okay, this tumor have three components. blastomal components that consist of some immature, undifferentiated tumor cells. That means blastomal components. The other component is areas of epithelial components. Epithelial component includes some abort renal tubules or glomeruli, but these are not completely matured. They are abort components. Okay, epithelial components, including aborts, tubules, renal tubules, or glomeruli of the renal tubules and glomeruli, which are aborts. As epithelial component. And the third component is stromal component. Stromal component includes spindle-shaped cells and are really mesenchymal components. Presence of fibroconnective tissue that can be cartilaginous or skeletal muscle or bony tissue. All of them may be present in a stromal component. Okay, what you should see in your slides, you see some blastomal components, immature cells or undifferentiated cells in some areas of the tumor are present. Epithelial component includes primitive tubules, primitive glomeruli. You see in this slide. These are immature or primitive tubules as epithelial components. Primitive tubules, epithelial components, primitive tubules. And mesenchymal component includes spindle-shaped cells, for example, skeletal muscle, or also maybe cartilaginous tissue present in mesenchymal components. So this picture includes all of three structures. You see in this part of the picture blastomal components. These one are epithelial component, and this area shows spindle-shaped appearance and are stromal component or mesenchymal component. Okay, so Bill's tumor includes these three components. If there is any question, you can see your slides. Okay? Any question? Okay. Okay. All of these slides you can see, and